Hey, in this video, I'm going to tell you why everything you've been told about disc herniations is actually wrong. Disc herniations are commonly found in people that have back pain. When they go to the doctor and get an MRI, they'll find in their MRI that there's levels of their spine right here. Here are the bones, here are the discs. The discs are between the bones. These softer structures, which are actually very, very durable, end up getting herniated or a piece of it starts to stick out and possibly compress on things like nerves and other things. There's a lot of misconceptions in the healthcare field about disc herniations, and I'm going to clear some of them up for you right now. The first misconception is that bending forward too often causes herniated discs. And the thought with this is that if you're bending your spine forward repeatedly like this and you're doing it too much, that it causes disc herniations on the back side of the disc, which pushes against the nerves. And so people think that if you're having to do some job where you're bending over, especially if you're bending over picking up something heavy, that's causing the disc to get squashed over and over again. Now, although this is partially true, I don't think that it's the reason why most people get back pain from disc herniations. I think the better way to look at this is bending over too often with a muscle imbalance, with the improper strength and coordination of the muscles that support the spine. That's what causes it correctly. To give you an analogy that might fit better is, it's kind of like saying if you drive your car too much, it's going to wear out the car parts, the tires, for instance. And although that is true with cars, they don't regenerate like our cells do. If you drive your car too often with your tires not aligned or not balanced, or if you're driving on the wrong road surfaces, then you're going to wear out your tires much more quickly than they normally should. The key difference is that the alignment of your tires or the balance of your tires or the surface you're driving on are problems for the car. If that was taken care of, then your tires should be able to last as long as they're intended to. That's what I'm saying here about the spine, is it's not just the act of bending over, just like driving your car is going to wear out your tires inappropriately and cause problems. It's the factors around the spine that are causing the problems of the disc herniation. It's the imbalance of muscles or the alignment in movement when you're moving. This is incredibly important because now this opens the door for you to bend over as much as you want, as long as your muscles are in proper balance, which I'll speak more to by the end of this video. The second thing that is often told to patients with disc herniation problems is that back exercises fix disc herniation problems, and this is just not the case. Let me explain a bit. Your healthcare provider, maybe your physician, maybe a physical therapist, someone else in the healthcare field might be telling you to exercise the muscles that run up and down your spine right here. These would be called your back muscles. We call them the spinal extensor muscles or the erector muscles. They have a bunch of different names. They're the muscles that you can reach right behind yourself and around your spine on the sides. They run up and down the sides of your spine. It would seem logical at the very first thought to exercise those muscles if you have a disc herniation, but actually it's the wrong thing to do. And here's why. This is more about the muscle imbalance that I was already talking about. You have three muscle groups that give stability and support and movement to your spine here, to your lower back. One is those back muscles here. A second one is the abdominal muscles. They're on the front of the body right here between the rib cage and the bottom of the pelvis here. And then they wrap around and they stabilize through the pelvis bones, and they also send tendons into the spine. And then the third group that can influence the spine are the hip flexor muscles. They come from the bottom up here and they attach to the spine in this area. Between those three muscle groups, you should have a relative balance of forces acting on the spine so that the proper movement happens between the vertebrae, which means the proper movement happens at the discs as well. Now, discs are designed to be loaded heavily, and they're designed to take all kinds of forces, but the one force that they're particularly not good at taking is twisting forces, especially with other forces combined, like compression and twisting, for instance. These back muscles, the ones that you are told to work out often, that I'm telling you actually should not work them out, they offer a lot of compressive forces as well as twisting forces. The back muscles, when they work one-sided, they can help bend you sideways and twist. So if you're doing a lot of twisting motions and your back muscles are already dominant in this imbalance. They're the ones that are working most of the time. Which signs of that are spasms in the area, tightness in the back muscles. If you go to do something, anything of significant intensity, like if you're on your feet too long, if you're doing some yard work, chores around the house, then your back muscles start to get tight and achy. That's a common sign of this back muscle imbalance. You're using your back muscles too much, and chances are you've got to get stronger in the abdominals in the front, possibly even the hip flexors or some other muscles in the area. What I would not do, because in the long term it makes you worse, maybe not in the short term. You might actually get some temporary relief in the short term, but it's just that, temporary relief. It's not long-term relief. In the long term, you need to be working out the other muscle groups and avoiding exercising the back muscles. And you'll be surprised if you do that, it makes a world of a difference. And we've got a bunch of videos on how to do that. They're linked in the description below. The third thing that you've been told that is actually wrong is that surgery fixes back pain from disc herniations. Now, surgery has its place. If a disc is herniated so bad that it's pushing on one of these nerves, and it is very obvious, I mean, you could see it clear as day on the MRI, and you have intense leg pain, you're having loss of muscle into the leg, like one leg is getting skinnier or smaller than the other leg because of this problem, then having a surgery on the disc to take the pressure off the nerve is probably going to be a good thing. But those cases are not the most common cases. If you have been told that you have a disc herniation and it's putting a little bit of pressure on your nerve back here, but you don't really have leg pain, then you can probably get better without having surgery on your disc ever. And even if you do have leg pain, there's other things to look at before going to go get a surgery here, because those nerves do bundle down and make the sciatic nerve, which pops out right here in this part of the bone. This bone could be shifted, and that might be the main reason for the pain going down your leg, rather than just the pinch up here in the disc. Now, I explain that because it's typically not looked at. You can't find a shifted bone on an MRI. Physicians and surgeons aren't typically looking for this pelvis bone to be shifted and pinching the sciatic nerve down here. They're looking at things that they can treat with their skill set, which is usually surgery, injections, and medications. So if a surgeon finds a massively herniated disc, they're going to think, let's go in and surgically operate. But what I'm telling you, you need to begin to think is, what else can I do to help get pressure off the nerve in other areas? It may be downstream on the nerve and in the sciatic nerve or right in this area. There's more and more research coming out as the years go on about how discectomy surgeries, which is a procedure used to take a chunk of a disc out, is actually not as good as we thought it was when it originally came out. When it originally came out, these are the surgeries, by the way, that they call the non-invasive back surgeries, where they put a Band-Aid on you right afterwards and you walk in and walk out the same day from the doctor's office. You don't even have to go to the hospital most times. We're starting to find out that these surgeries are really only good at providing temporary relief, and with follow-ups, with year and multiple year follow-up studies, they're finding that people get back pain again. It returns. I wonder why. I think there's something to that muscle imbalance that I was telling you, because surgery does not fix muscle imbalances. And usually that's the root problem for disc-related problems. And if that root muscle imbalance is not addressed, even though you had a surgery on the disc, the back pain is going to come back. The disc herniation is potentially going to get worse. Another misconception that you get told all the time is that steroid injections can help to fix back pain from herniated discs. And this is not correct. It only provides temporary relief. Now, surgeons and physicians out there will commonly offer an injection, a cortisone injection is what's commonly offered, into the area of your back pain so that you can get some relief. And this is great at providing some short-term relief. It can make a tremendous difference in allowing you to move better, to sleep better, to just function better throughout the day. But you have to understand that it is short-lived, it's temporary, and it doesn't always get the relief that people are looking for. Sometimes it just takes the edge off. It doesn't take the pain away completely during the time that it's supposed to be effective. And in some cases, it doesn't even touch the pain. I've had patients that have gone in for the cortisone injection and come back saying, I'm exactly the same. In fact, I just feel like I got a little bit worse from the actual injection, the needle going in, and some soreness afterwards. But what you've got to understand is that injections don't fix muscle imbalances. That's the root problem, is there's an imbalance of forces on the spine causing the disc to herniate, and that can't be addressed with medications or surgery. And it requires the right kind of exercises, because if you do the wrong kind of exercises, the ones that we're typically told to do, it can actually feed into the imbalance. Now the next one, I hear this one especially from patients that have gone to physical therapy clinics and other places. I hear this from people all over the country. It's that discs slip out of place and that they need to do exercises to slip them back in. So the theory with this is that here's your discs right here in your spine, is that the discs can shift backwards or shift forwards depending on the movements that you're doing. And this is an incorrect understanding of the anatomy, especially the microscopic anatomy. If you look down at the connections between the discs and the vertebrae, they are so connected. The fibers are so intertwined. There is no budging that disc. It is not ever going to disconnect from a bone unless you have some very traumatic accident happen, like a car accident or you know, some sort of vehicle accident that just destroys your back. But, and I mean, you have to have like massive surgeries, bone fractures, because if you had a car accident, but it wasn't, you know, like you had a bunch of fractures all over the place, then I doubt your disc was actually slipped, even though you may have been told that. What's more often the case is you have a herniation, and on the MRI, it looks like the disc is moving backwards, but all the connections on the front side are probably still there just fine. It's not sucked in on the front too. It's just squashed and shifted backwards. The back part of it is shifting out backwards. That's the herniation. So because of this mind picture of a disc actually slipping, then people often get the thinking, well, can't we just slip it back into the position it's supposed to be in? Can we pop it back into place? And popping especially is something that people look at because they get back pain and they want to pop their back through a healthcare professional doing it, like a chiropractor or a manual therapist like myself, or they might even try to self-pop it doing twisting techniques, and they'll get relief doing it, and they're starting to tell themselves, oh, my disc slipped back in, so that popping technique helped. I popped my disc back in. But what usually is popping is the joints back here. They're unsticking, they get stuck, and that when the joints get stuck, they're right here where I'm trying to dig my fingernail, right between the surfaces right here. You have two surfaces on either side. Those are called facet joints. Those are the joints where the primary motion happens in the spine. Those are the joints that get stuck. Those are the ones that get arthritic. That's where you have some cartilage in there that moves quite a bit. Those are the ones that pop whenever techniques are done to the back to make it pop and free up. That's why you have an increase in motion and such a big relief. The movement there is so important so that you allow proper pressure and loading of the discs. And so if you can maintain good motion in your joints back here in your spine, then you'll have better disc health overall. But it's not your discs sliding in and out or slipping in and out. It is very much the facet joints back here that we need to focus on, and the muscle imbalance to make sure the pressures are right on the discs. But the final thing I want to share with you is that discs cannot heal on their own. People get told this all the time, especially in surgeons' offices, and they have good reason to tell them that because they want to do surgery on you. But it's not just that. There is no research showing that discs heal very well. There is some research out there showing that discs can heal, but it doesn't show that they heal very well. And when I say heal, it doesn't mean that they unherniate necessarily. They just stop the inflammation process. They may still be herniated on an MRI. More importantly, the individual can get relief of their back pain and even relief of leg pain shooting down into the leg coming from a pinched nerve in the back. People with disc herniations can get tremendously better, can get back to being active and healthy, can even get back to exercising, including weightlifting where you're loading the spine. It's just a matter of fixing the muscle imbalance, which is a process that takes some time. Now, quick side note, I've got a program here. It's linked in the description below. It's called the 28-Day Back Health and Wellness Boost Program, and it's designed at fixing that muscle imbalance that I've been telling you about. The abs on the front typically get weak. Hip flexors can be a problem. The glute muscles in the back are often involved too. And the main thing that is causing back problems is those back muscles back here are way too strong and tight. That's why you feel tightness back there, or tiredness is another thing that people say. and it causes excessive compression in the back of the spine, and any twisting motions really can set it off. This program is designed to treat the root imbalance, to take the pressure off the back. And if you decide to do the program, you'll see there is nothing where you're going to be working your back muscles. It is completely focused on everything else so that you can take pressure off your back and truly begin the process of reversing the imbalance to get proper pressures back on your spine and allow your disc to heal. Now back to discs healing on their own. Discs are made of living tissue. A lot of people don't realize that it's cells in there that have metabolism. They're alive, which means they can heal, they can grow, they can get thicker, they can get more integritous, they can be in a position to take better weight. It's not like nails or hair that just keeps growing and the tissue right at the end of the nails you clip off. It's dead. It doesn't hurt to clip your nails as long as you don't cut it too short. Same thing with your hair. It doesn't hurt to cut your hair because it's kind of dead tissue. It's not living anymore. Now the roots are living. The root of your nails are living for sure, and they're generating more nails, but it's not like that in here. You can't just clip it off in a surgery and expect for it to grow back normally. Cells inside your discs have the ability to heal. They just heal slow. They're some of the slowest healing tissues of the body. And if you put the right pressures on them, as I show you in the 28-day back health and wellness boost program, you can put them in a position to heal and prevent your disc from herniating worse, and from this back pain related to the disc herniation from returning over and over again. If you've got questions about disc herniations, drop them in the comments below. Let us know if any of our exercises that you've done from our other videos have helped you out. And if you're looking for those exercises, go down into the description below and you'll find a ton of free help, as well as links to our 28-day back health and wellness boost program. I'll catch you in the next video, friends. Bye-bye.